summarize it maybe a bit here before we go to actually the tape, maybe perhaps even after the break. Well, maybe I can show you at least one clip before the break. So I think about the 4S to help clients to grieve. Okay, this is my wording. Not necessarily all the EFT community people uses it, but this is the way that I think about it, right? But it's, in a way, it takes into the account of the tangles. Okay, so let me just go through it with you first, see whether that makes sense for you. And now I'm going to break it down and actually show you tips around those 4 points. Okay. So again, similar to what I said to Aurora earlier, right? This is typically the work of EFT therapists. You always start with where people are at. Always. EFT is an experiential therapy. You always be present with your clients, wherever they're at. Not where you want to go as a therapist, right? But it's about starting where they are at. We want to first access the window tolerance to know where they are at, right? What can they handle? Are they able to handle maybe 3 feet of water, 6 feet of water, or not even? They can only dip their toes in the water. So we access that, assess where they are at, right? And usually that's where you start, where the block is, right? Usually, typically with all our clients, unless they already done a lot of work before they come to see you, usually we'll see blocks coming up. So perhaps that's where they're at. You start there. In fact, that's the first clip I'm going to show you later, is to start to look at Kathy's block. I'll say more about it later, right? So here's where we want to move with their pain. The pain of the block, right? Because there's an emotional block, a pain that shows up, or why they have a hard time breathing well. My thinking about doing this EFT work with grief is I want to help them to move through this grief eventually, right? But able to grieve well. But if there's anything that's blocking the attachment channel, I need to help them with it. So you first begin by moving with their pain. So this is usually tangle 1 comes in. I want to help them to reflect the present process. Hey, I know this, and I won't use this wording, but I noticed that this is a block here, right? This is where I noticed this is what happened to you. With Kathy, the girl that I'm going to show you later, I noticed that in our work together, especially when the grief comes up, right? Or the topic of the dad comes up, she smiles a lot. She smiles, she laughs a bit, even though she's talking about something around sadness, right? So that's a pretty good indication, right? We see the incongruency with that. So we want to reflect on what's happening there, right? So you will see that. Number 2, the second S is about staying with the pain, making space for all kinds of emotions. That's always the hardest, right? Because we don't like pain. We don't even like to see our clients in pain. But yet that's also where we need to be courageous to go into the pain. Here's where you want to move into the pain, right? You want to, I guess what you're thinking is you're trying to allow all kinds of emotions, anything from both happy and sad and anything in between, right? So you're not limiting, you're not privileging certain kind of emotion only. You allow all different kinds of pain to show up, right? So what I would like to be able to see, and which is what I want to show you too, is with Kathy, after working with a block, I want to move into her attachment pain, which in the EFT work is a deeper pain.